Did you see the change there? Two things that I think we've got in common with Shona Robison, the Cabinet Secretary. Firstly, for you, is her background here in Glasgow with social work as a home care assessor a number of years ago before she entered the world of politics. That's your connection with her. My connection is Dundee. As the Director of Social Work until 3 years ago, Shona was and is the MSP, so many a discussion I've had with her both before entering government and in my current role. I do know that she is extremely disappointed that she can't be here, particularly because it's about care at home. But as Donald said, there was a three-line whip today in relation to the referendum. I'm going to cover a number of areas this morning, and first of all, the long-term reform of care. We recognise that the social care sector faces many challenges. People are living longer, which is great, but that means extra demands on vital services such as home care. Public funding is tight. We all need to ensure that every penny is spent as effectively and efficiently as possible. And the public rightly expects the highest standards for the people we care for. They expect us to support them to achieve the things that really matter to them. I'm going to talk about investment in a minute. However, whatever the resources we have available, we know that reform and innovation is vital in enabling us to deliver the high-quality, person-centred care that we are all striving for the people of Scotland. That's why the process of reform to social care currently underway is so important. It's being led by the Delivering Change in Adult Social Care Partners Group, which includes all the main organisations involved in delivering care in Scotland, including Scottish Care and COSLA. The Scottish Government has been pleased to join up with organisations on the Partners Group to support the recruitment of a national home care and support development officer to be based in Social Work Scotland and reporting to the Partners Group. This post will work to improve understanding of the range of issues affecting the social care sector, particularly in home care, and to develop a plan of action to address these. There will be a focus on some of the key challenges and opportunities facing the sector, such as recruitment and retention, and new models of care, including the use of technology. The Cabinet Secretary is looking forward to hearing the results of this work, which will be considered by the Ministerial Strategic Group for Health and Social Care, for which she chairs. The process of reform will help to provide the foundation of a long-term social care plan, which will continue to drive to end time and task-based care and make the shift to care which truly focuses on outcomes. We recognise the commitment shown by home care workers on a daily basis and their desire to make a difference to people's lives by providing high-quality care. Last year, local authorities and care providers worked with us to start to improve wages in the sector, to recognise this commitment and help to tackle recruitment and retention issues. This resulted in investment last year to promote fair work in social care. Additional investment is being made this year so we can make further progress together. The Scottish Government is committed to improving the quality of care in Scotland, and that's why our 2016-17 budget set out investment of a further £250 million each year through health and social care partnerships and grow our social care services. Of this £250 million, 125 is to provide additional spend on social care to support the objectives of integration, including through making progress on social care, charging thresholds for all non-residential services to address poverty. This additional money also reflects the need to expand capacity to accommodate growth in demand for services as a consequence of demographic change. The remaining $125 million is being provided to help meet a range of existing costs faced by local authorities in the delivery of effective, high-quality health and social care services in the context of reducing budgets and to enable adult care workers to be paid the living wage from October this year. Paying the living wage for care workers, the vast majority who are women, will help improve the incomes of these absolutely crucial workers, retain their talents in the sector, and lay strong foundations for the future as the population ages and demands for their services increases. This significant injection of resource will allow local authorities to commission care services from the independent and voluntary sectors on the basis that care workers are being paid the full living wage of £8.25, giving up to 40,000 people doing some of the most valuable work in Scotland a much-deserved pay rise. We have worked with COSLA and care provider organisations to produce guidance on the delivery of this commitment, which stresses the need to fully involve providers in implementing this. The benefits of paying the living wage are significant to employees and employers alike. We know that it can contribute to a small in absenteeism, enhance quality of staff engagement and productivity, and a significant impact on recruitment and retention of staff. We all recognise that paying the living wage is a move in the right direction. However, there is a lot of work to be done between now and October to ensure that that is implemented properly. The Scottish Government is committed to improving conditions in the social care sector, and only by working together across local and national government and with the sector here will achieve this. I just mentioned social care charges. Within the £250 million, the Scottish Government provided funding of £6 million to local authorities to raise the thresholds at which point people become eligible for social care charges from the 1st of April this year. Ministers are keen to see further progress in improving the fairness of the charging system over the course of this Parliament. Our legislation to integrate health and social care was described by the First Minister as the most important reform of care since the inception of the NHS in 1948. We're proud that every partnership in Scotland was up and running by the 1st of April this year. Partnerships must hit the ground running and deliver the level of ambition and innovation that we're looking for. Indeed, the scale of ambition and innovation that is necessary for us to deliver the aspirations of the people who use our services. I'm sure that we all share their aspirations of wanting to live as independently for as long as possible, preferably in our own homes. It is what we would want for our loved ones and for ourselves when that time comes. That's only possible with good quality home care. Those people who know best how these services should be delivered will be those who receive these services and those who provide them. That is why we need you to be involved in designing services, the way services should be delivered in the future, through the local strategic commissioning process. Strategic commissioning is still at the very early stages in many partnerships. It will evolve and improve over the coming years. Scottish Government officials, along with the new Integrated Improvement Hub at Healthcare Improvement Scotland, will help in this evolution, and you can too. There are already emerging areas of good practice. In Highland, for example, they've shown what is possible in terms of developing relationships, practices and behaviours by engaging in truly collaborative working, and we also heard from David earlier on the very same subject. An independent sector provider from the home care sector co-chairs the strategic planning group. This has overseen the development of the single tariff for an out-of-home care and a move from traditionally timed visits to an outcomes-focused provision. Part of the agreement in Highland is that no one will be delayed in hospital while waiting for home care. Ministers remain committed to eradicating delayed discharges and resolving once and for all the scourge of people needlessly and inappropriately being delayed in our hospitals. In order to do this, we must have an absolute focus on keeping people at home and returning them there if they do need to be in hospital. This requires a strong and resilient home care sector supported by intermediate care and reablement. Dementia has been a priority for the Scottish Government since 2007, and it remains so. We've had 2 national strategies, with a third to follow this year. We will continue to support the whole system modernisation of dementia care to meet the needs of people with dementia, including care at home. As part of this work, about 1,100 dementia ambassadors, 675 in the independent sector, have been identified in a range of social care services to take a vital role in leading the training and development of their local staff. This has been one significant part of wider national dementia strategy, workforce education, training and development, which will continue in the next dementia strategy and include supporting care, home and care at home staff. Supporting dementia staff and services across Scotland remains at the heart of our endeavour to help them to continue to take our shared human rights approach to dementia care that underpins the dementia standards. The Scottish Government is committed to providing innovative, high-quality health and social care services that will help improve the lives of vulnerable people across Scotland, and to help support the integration agenda along with key partners such as the Care Inspectorate, Healthcare Improvement, Scottish Care, Scottish Human Rights Commission, and a host of other organisations. We are currently developing new standards that will apply across all health and social care services. People who need to use health and/or social care services are entitled to receive the highest possible standards of care and support, whether provided in a care home, hospital setting, a GP surgery, or indeed their own home. As we live longer, we need to be supported to live as independently and as healthy a life as possible at home and in our communities. Self-directed support empowers individuals to have choice and control in deciding how their support is delivered and take ownership of their own health and well-being. By focusing the importance of initial quality conversations and asking individuals, what matters to you? We are facilitating the production of care plans tailored to meeting personal outcomes created in equal partnership. We are all striving for true person-centred preventative care for all. We know that this poses a challenge, but much of the work is already being achieved by some people in some places. We're already seeing innovative packages of care helping to meet these personal outcomes. Commissioning strategies across the country are already reflecting this person-centred approach. And we're already seeing a workforce that is empowered to listen and make simple changes that are making real differences to people's lives. But there is, of course, much more to be done. We want everybody to be empowered to live as independent a life as possible. We want our health and social care systems to be focused on the user, ensuring that individual views and choices are listened to, valued, and appropriately acted upon, and that services are planned and delivered around their needs. We want people to be supported as long as possible in their own homes and communities. We've talked about the living wage However, we know that addressing issues around recruitment and retention needs to go further. We need to look at other issues that impact on the social care workforce. Our ambition is to have in place excellent social services that are well led, continually improving, and most importantly, responsive to and led by the needs of service users and carers. To deliver this ambition, we need a skilled and valued care workforce. The continued development of this workforce through support and through regulation remains a strategic priority for the Scottish Government. As this audience will be aware, our policy on registration of the workforce with the Social Services Council specifically aims to improve outcomes for service users by increasing their skills, qualification, and the quality of the workforce. And I was pleased to see the progress that's been made in the SSSC's 2016 March report, A Trusted and Skilled and Valued Social Services Workforce, with all care workers in care home services required to be registered from last year, and a significant expansion occurring next year with the inclusion of support workers in care at home and housing support. Scottish Care is playing a key role in this work. With support from Scottish Government, you're supporting workforce development in this sector and helping to deliver significant policy initiatives such as health and social care integration and the National Dementia Strategy, amongst others. The Frontline Support Worker Forum is an excellent example of staff engagement, and your report, Voices from the Front Line, published earlier this year, gives a valuable opportunity for the views and experiences of frontline social care workers to be heard. I very much welcome the significant contribution that Scottish Care is making to this agenda. Last year, the Vision and Strategy for Social Services 2015-2020 was published. Implementation is being supported by the Social Work Services Strategic Forum, chaired by Mark MacDonald, the Minister for Childcare and Early Years. The vision was developed by the sector, for the sector, and there are representatives from key stakeholders across the sector on the forum, including Donald from Scottish Care. The report on the first year of implementation highlights the range of work being done by partners across the sector to contribute to this vision. This work includes refreshed codes of practice for social services workers and employers to be launched later in the year. The codes will continue to underpin this agenda, for example, by setting out employers' responsibilities to ensure that staff are supported to achieve qualifications and continuously develop their skills and knowledge. Good progress has been made on new guidance for safer recruitment and on induction. Research has been commissioned on recruitment and retention challenges, on workforce planning, on public perceptions of the sector. There's continued engagement by the Scottish Government with the frontline workforce through events attended by ministers to ensure we maintain an up-to-date understanding of the challenges and concerns of the sector. Continued efforts across the sector will be needed to meet these challenges. The Scottish Government will continue to work with Scottish Care and other partners to help deliver the vision and strategy and the ambition for social services that I set out earlier. Supporting the workforce is a key focus of the work, and I would like to recognise and acknowledge here the invaluable contribution this workforce makes to supporting those who need your care. The Scottish Government is also supporting innovative work through Living Well in Communities and is looking to pilot the Buurtzorg model of care in Scotland, referred to by Bridget earlier. Living Well in Communities is a new portfolio of improvement work which is currently supporting people to spend more time living at home or in a homely setting which would otherwise be spent in hospital. It involves a range of stakeholders across the landscape, including health and social care partnerships, housing associations, third sector organisations, and private sector social care providers. It promotes prevention, anticipation, and supported self-management, and has an emphasis on ensuring that people who are admitted to hospital are able to return to their homes or a community environment as soon as appropriate, with minimal risk of readmission. Finally, I know the Cabinet Secretary would have enjoyed being here to tell you how important home care is to her personally and to our wider policy on care and support. She would also like to have heard from you about the positive changes that are happening in the social care sector, as well as the undoubted challenges that you face. The Scottish Government is placing an emphasis on moving away from hospital-based care, and the First Minister has said that her priority is to shift the proportion of spending to primary social care and mental health settings. And the investment of £250 million I referred to earlier shows that government is taking seriously the need to ensure that the social care sector is adequately funded to provide the care that is so essential to so many people across Scotland. Thank you.